Understanding COPD. Definition and pathology of COPD. Chronic Obstructive Pulmonary Disease is a progressive inflammatory lung disease characterized by obstructed airflow from the lungs that interferes with normal breathing. It primarily encompasses two main conditions, emphysema and chronic bronchitis. In emphysema, the air sacs at the end of the smallest air passage, the bronchioles of the lungs, are destroyed as a result of damaging exposure to cigarette smoke and other irritating gases and particulate matter. Chronic bronchitis involves long-term cough with mucus due to inflammation of the lining of the bronchial tubes. The pathologies lead to reduction in the rate of airflow both in and out of the lungs, contributing to an increased work of breathing and a feeling of breathlessness. Symptoms and complications. COPD symptoms include chronic cough, increased sputum production, shortness of breath, especially during physical activities, wheezing, and chest tightening. As the disease progresses, symptoms often worsen, significantly impacting quality of life. Patients may experience exacerbations, which are periods when symptoms become far worse than their usual day-to-day variations and persist for a period of at least several days. Complications of COPD can include frequent respiratory infections, heart problems, lung cancer, high blood pressure in the lung arteries, pulmonary hypertension, and depression. Acute exacerbations can lead to significant worsening of lung function and are often triggered by infections and environmental pollutants. Relevance to EMS. Understanding COPD is crucial for EMS professionals as it impacts management and treatment of patients with respiratory complaints. COPD patients are at an increased risk of respiratory distress, and their condition can deteriorate rapidly. Recognizing the signs and symptoms of COPD exacerbation, including increased breathlessness, wheezing, and productive cough, is vital for timely EMS intervention. EMS providers play a key role in managing exacerbations and preventing complications. This includes the administration of oxygen therapy, bronchodilators, and in some cases, continuous positive airway pressure, especially during severe exacerbations that lead to significant hypoxemia. The ability to effectively manage COPD patients in the pre-hospital setting can reduce the need for invasive ventilation and improve patient outcomes. Etiology of COPD. The primary etiological factor for COPD is tobacco smoking. Long-term cigarette smoking causes chronic inflammation, damages the airways and lung tissue, and impairs normal clearing mechanism of the lungs. Apart from smoking, other significant factors include exposure to air pollutants, both in the home and the workplace, genetic factors, and history of frequent childhood respiratory infections. These factors contribute to the development of COPD by causing prolonged inflammatory responses in the airways and lung parenchyma, leading to fixed airflow limitations and parenchymal destruction. Progression and chronic symptoms. COPD progresses gradually, and its symptoms worsen over time. Early in the disease, the symptoms may be mild or even absent. As it advances, the primary symptoms include chronic and progressive dyspnea, chronic cough, and chronic sputum production. Patients often experience periods of exacerbation where symptoms become significantly worse. These exacerbations can be triggered by respiratory infections or environmental pollutions and are characterized by increased breathlessness, cough, and sputum production. The disease progression is often associated with a decline in quality of life and an increased risk of mortality, primarily due to respiratory failure or complications like pneumonias and acute exacerbations. COPD in emergency scenarios. In emergency scenarios, COPD poses unique challenges. Patients with COPD exacerbations often present with severe respiratory distress, hypoxemia, and sometimes altered mental status due to hypercapnia. Acute exacerbations are among the most common reasons for emergency medical service calls in patients with COPD. EMS providers need to be adept at quickly assessing the severity of the exacerbation, providing immediate care, which may include oxygen therapy, nebulized bronchodilators, or in severe cases, CPAP, to assist with the ventilations. Understanding the chronic nature of COPD and the potential for acute exacerbations helps EMS providers anticipate complications and deliver appropriate pre-hospital care. Airway anatomy and physiology. Understanding airway anatomy and physiology is foundational for effective airway management. The airway can be divided into the upper and lower airways. The upper airway consists of the nasal and oral cavities, pharynx, and larynx, which function to warm, filter, and humidify inhaled air. The lower airway includes trachea, bronchi, bronchioles, and alveoli, primarily involved in gas exchange. Airway patency, or the open state of the airway, is critical for effective breathing and can be compromised by various factors such as obstructions, inflammations, or fluid accumulation. EMS professionals must understand these structures and their functions to recognize and manage airway problems effectively. Principles of airway assessment. Airway assessment is a critical first step in patient management. This begins with evaluating the patient's ability to speak, as it indicates the patent airway. Look for signs of airway obstruction, such as stridor, use of accessory muscles, or paradoxical chest and abdominal movements. Assessing the risk factors for airway compromise, such as trauma, swelling, or foreign bodies, is also essential. This assessment should be rapid and accurate, forming the basis for immediate intervention decisions. Remember, the airway status can change quickly, so continuous monitoring is necessary. Common EMS airway management techniques. Common EMS airway management techniques include a range of non-invasive and invasive methods. Non-invasive techniques include positioning, suctioning to clear secretions or vomit, and the use of airway adjuncts like oropharyngeal or nasopharyngeal airways. Oxygen administration is also a key component, often delivered via nasal cannula or face mask. For more severe airway compromise, advanced techniques such as endotracheal intubation or use of supraglottic devices may be required. Familiarity and proficiency with these techniques are also crucial for EMS professionals to ensure rapid, effective airway management in various emergency scenarios. Challenges in COPD patients. Airway management in patients with chronic obstructive pulmonary disease presents unique challenges due to the structural changes in their airways and lungs. The primary issue includes chronic bronchitis and emphysema, leading to narrowed airways and less elastic alveoli, respectively. This results in decreased airflow and increased worker breathing. COPD patients often have an increased risk of airway collapse, excessive mucus production, and hyperinflation of the lungs, which can impede effective ventilation. Additionally, these patients may have a blunted respiratory drive, making them more susceptible to hypoventilation, particularly when given high concentrations of oxygen. EMS providers must be aware of these challenges to tailor their airway management approach effectively. Use of airway adjuncts. In managing COPD patients, airway adjuncts play a crucial role. The use of non-invasive positive pressure ventilation, like CPAP or BiPAP, can be particularly beneficial. These modalities help by increasing airway pressure and preventing airway collapse, thus improving alveolar ventilation and reducing the work of breathing. For patients in severe respiratory distress or those unable to protect their own airway, more invasive techniques such as endotracheal intubation may be required. However, the decision to intubate should be made cautiously, considering the risks and benefits, as intubation can lead to complications like barotrauma due to the underlying lung pathology in COPD. Signs of airway compromise. Recognizing signs of airway compromise in COPD patients is critical for timely intervention. These signs include increased use of accessory muscles for breathing, paradoxical chest and abdominal movement, cyanosis, altered mental status, and in severe cases, inability to speak in full sentences. Wheezing and decreased breath sounds may also be present, indicating significant airflow obstruction. Monitoring oxygen levels and assessing for signs of carbon dioxide retention are essential parts of the assessment. EMS providers should be vigilant for these signs to promptly identify airway compromise, initiate appropriate management. CPAP is a non-invasive ventilation technique used in the management of patients with respiratory distress. CPAP works by delivering a steady stream of air at a set pressure through a mask that covers the nose or the nose and mouth. This constant air pressure helps to keep airways open, particularly during the end of expiration, preventing airway collapse. CPAP does not provide breaths for the patient, but instead supports the spontaneous breathing efforts by maintaining a constant level of positive pressure throughout the respiratory cycle. In COPD patients, CPAP provides several physiological benefits. By increasing the airway pressure, CPAP helps to reduce the work of breathing and improves oxygenation, which is particularly beneficial during exacerbations of COPD. It counteracts the collapse of the small airways in the alveoli, facilitating better air exchange and reducing the trapped air in the lungs, thus improving ventilation perfusion matching. Additionally, CPAP can reduce the pulmonary artery pressures, alleviating the load on the right side of the heart, which is often compromised in severe COPD cases due to pulmonary hypertension. Indications and contraindications. The primary indication for CPAP in COPD is acute exacerbation with moderate to severe respiratory distress, not relieved by standard medical treatments like bronchodilators and corticosteroids. It is also indicated in cases of cardiogenic pulmonary edema and some cases of pneumonia or acute respiratory distress syndrome. However, there are contraindications to be mindful of. These include hypotension, vomiting, or high risk of aspiration, facial trauma or deformities that may prevent an adequate mask seal, and a decreased level of consciousness or an inability to protect the airway. CPAP should be used cautiously in patients with a history of pneumothorax or those at risk of barotrauma. CPAP works by providing a constant and continuous stream of pressurized air through a mask, which is either fitted over the nose or the nose and mouth. This stream of air creates a pneumatic splint for the airways, keeping them open throughout the respiratory cycle. The pressure is typically set based on the patient's requirements and is consistent during both inhalation and exhalation. This mechanism is particularly beneficial in patients who have difficulty keeping their airways open, as it prevents airway collapse and assists in stabilizing the lower airway and the chest wall. Preventing airway collapse. One of the critical functions of CPAP is to prevent airway collapse, especially in conditions like obstructive sleep apnea and COPD. In these conditions, the airway are prone to collapse due to factors like decreased muscle tone or loss of elasticity in the airway walls. CPAP maintains positive pressure in the airways, counteracting these tendencies and keeping the airways open. This is particularly important during expiration, when the airway collapse risk is higher in these patients. Improving oxygenation. CPAP improves oxygenation by enhancing alveolar ventilation. By keeping the airways open, it ensures more consistent and efficient gas exchange in the lungs. This is vital in conditions like COPD, where poor ventilation can lead to significant oxygenation problems. CPAP also helps in redistributing lung fluids in conditions like congestive heart failure, thereby improving the functional residual capacity of the lungs and enhancing oxygenation. The improved airway patency and lung mechanics lead to better oxygen delivery to the body's tissues, crucial in managing respiratory distress and failure. Types of CPAP devices. There are various types of CPAP devices available, each designed to cater to different patient needs and clinical settings. In the EMS setting, portable CPAP units are commonly used. These are powered by oxygen flow and designed for rapid deployment in the field. Hospital-based CPAP machines are typically larger and offer more advanced features such as integrated humidifiers and adjustable pressure settings. Understanding the specific type of device available in your service and its capabilities is crucial for effective application. CPAP components. The key components of a CPAP system include the mask, tubing, and a pressure generation unit. The mask, which can be nasal mask, full mask, or nasal pillows is crucial for delivering pressurized air effectively and comfortably to the patient. The tubing connects to the mask to the CPAP machine, and its flexibility and length are important for patient mobility and comfort. The pressure generator is the core of the CPAP machine, responsible for creating the continuous flow of air at the set pressure. It's essential to ensure that all components are compatible and properly connected for the CPAP system to function effectively. Setup and troubleshooting. Setting up a CPAP device involves assembling the components, setting the prescribed air pressure, and ensuring proper fit of the mask to the patient. It is important to check for air leaks and comfort once the mask is fitted. Familiarity with the device's operation, including how to adjust and read alerts, is essential. Troubleshooting common issues like mask discomfort, air leaks, or pressure problems is a critical skill. This includes checking for blockages in the tubing, ensuring that the mask is appropriately sized and positioned, and adjusting the straps for a better fit. If the machine is not functioning correctly, check for power issues, ensure all connections are secure, and verify the settings are correct for the patient's needs. Patient assessment for CPAP. Before initiating CPAP therapy in COPD patients, a thorough patient assessment is crucial. This assessment should include evaluating the severity of the patient's respiratory distress, level of consciousness, and ability to protect their own airway. Assess for signs of acute exacerbation of COPD, such as increased dyspnea, use of accessory muscles for breathing, and cyanosis. Also consider the contraindications to CPAP, like nausea, vomiting, and hypotension, or altered mental status. Confirming the patient's history of COPD, their current medications, and previous response to therapies will guide the appropriateness and settings for the CPAP application. Application procedure. Once the patient is assessed and CPAP is deemed appropriate, begin the application procedure. First, explain the process to the patient to alleviate any anxiety and ensure cooperation. Select the appropriate mask for the patient and adjust it for a snug but comfortable fit, assuring there are no air leaks. Connect the mask to the CPAP machine, set the initial pressure, usually starting at a lower setting, like 5 centimeters of water, and gradually increase as tolerated by the patient and as needed based on their respiratory status. It's crucial to continuously engage with the patient during this process to ensure comfort and effectiveness. Monitoring and adjustments. Continuous monitoring is essential after CPAP application. Monitor the patient's respiratory rate, oxygen saturation, heart rate, blood pressure, and level of consciousness. Look for improvements in respiratory distress symptoms and oxygenation, but also be vigilant for potential complications like pneumothorax or worsening respiratory failure. Adjustments to the CPAP settings may be required based on the patient's response. If the patient's condition does not improve or worsens, be prepared to escalate care, which may include advanced airway management. Documentation of all observations, settings, and patient responses is crucial for ongoing care. Comfort and patient compliance. Ensuring patient comfort and compliance is a critical aspect of successful CPAP therapy. Discomfort and anxiety can lead to non-compliance, which undermines the effectiveness of the treatment. It's important to choose the right size and type of mask to minimize discomfort and air leaks. Engaging in clear communication to explain the purpose and the process of CPAP can help alleviate patient anxiety. Adjusting the straps for a secure yet comfortable fit and using features like ramp settings to gradually increase pressure can also improve tolerance. Additionally, monitor for skin breakdown or pressure sores from the mask, especially in prolonged use, and reposition the mask as needed to prevent these complications. Continuous reassessment is vital in CPAP therapy to ensure its effectiveness and to identify any issues promptly. Regularly monitor the patient's respiratory rate, oxygen saturation, heart rate, blood pressure, and overall respiratory effort. Observe for signs of improvement in symptoms like reduced work breathing and increased comfort. If the patient shows signs of increased distress, agitation, or hypoxemia, reassess the fit of the mask, check for equipment malfunction, and consider if alternative therapies or interventions are necessary. Effective reassessment also involves listening to the patient's feedback about their comfort and adjusting the therapy accordingly. Adjusting CPAP settings. Adjusting CPAP settings may be required based on the patient's response to the therapy and reassessment findings. Common adjustments include modifying pressure settings to ensure adequate ventilation while also maintaining patient comfort. If the patient appears to be tolerating the initial pressure poorly, it may be necessary to lower it, then gradually increase it. On the other hand, if there is insufficient improvement in respiratory distress or oxygenation, a higher pressure may be needed. Understanding the interplay between pressure settings and patient's response is key to effective CPAP management. Always be sure that any adjustments are within a safe and recommended range for the patient's condition. Potential CPAP complications. While CPAP is generally safe, it can have complications. One common issue is air leakage, which reduces the effectiveness of the therapy and can cause skin irritation where the mask contacts the face. Gastric distension can occur if the air pressure is too high, leading to discomfort or even an aspiration risk. In some cases, especially patients with underlying heart conditions, CPAP can cause pneumothorax or lead to worsening of heart failure due to increased interthoracic pressure. There's also a risk of drying out the nasal passages and the throat, leading to discomfort and potential mucosal damage. Management strategies. Effective management of CPAP complications includes ongoing patient monitoring and timely intervention. For air leaks, readjusting the mask or trying a different style mask can be helpful. Lowering the air pressure can alleviate discomfort from gastric distension, and using CPAP device with a built-in humidifier can help in drying of the nasal passages and throat. In cases of suspected pneumothorax or acute heart failure exacerbation, immediate medical evaluation is necessary. Educating patients on what to expect and how to signal discomfort or problems can also help in early identification and management of complications. Transition to other support forms. In some cases, CPAP may not be sufficient, or complications may necessitate transitioning to other forms of respiratory support. If a patient's condition deteriorates, or if they are unable to tolerate CPAP, a more advanced airway and ventilation strategy may be required. This could include the use of BiPAP, which allows for different pressures during inhalation and exhalation, or invasive mechanical ventilation for patients who are critically ill. The decision to escalate care should be based on a thorough assessment of the patient's respiratory status, underlying health conditions, and response to the CPAP therapy. Consent in incapacitated patients. Obtaining consent for medical treatment is a fundamental ethical and legal requirement. However, in emergency situations, particularly with airway management, EMS providers often encounter patients who are incapacitated and unable to provide informed consent due to their medical condition. In such cases, it's essential to operate under the principle of implied consent, where it is assumed a reasonable person would consent to emergency treatment if they were able to do so. Despite this, providers must still make every effort to communicate with the patient, explain the procedures being performed, and respect the patient's autonomy and dignity as much as possible. Accurate and thorough record keeping. Maintaining accurate and thorough records is not only a legal requirement, but an ethical one. Detailed documentation on the patient's condition, treatments administered, changes in symptoms, and any communication with the patient's family members is crucial. This includes recording the specifics of CPAP therapy, the settings used, patient's response to the treatment, any adjustments made, and the reasons for those adjustments. Accurate record keeping ensures continuity of care and is essential for legal and professional accountability. Scope of practice guidelines. EMS professionals must always practice within their scope of practice as defined by their licensing or certifying body and their medical director. Scope of practice includes procedures, actions, and processes that a healthcare practitioner is permitted to undertake based on their professional license. When applying CPAP, it is imperative to adhere to these guidelines, including understanding when and how to use the device, recognizing potential complications, and knowing when to escalate care. Staying within the scope of practice not only ensures the patient's safety, but also protects the provider from legal and ethical ramifications. Importance of CPAP in COPD management. The use of CPAP in managing COPD, particularly during acute exacerbations, cannot be overstated. CPAP therapy plays a crucial role in improving oxygenation, reducing the work of breathing, and potentially preventing the need for intubation. It's a vital tool in the EMS toolkit for managing respiratory distress in COPD patients, helping to stabilize during transport and potentially improving outcomes.